Good morning. This webinar will begin shortly.
Good morning. Thank you for joining us today for our briefing, Leading by Example, Supporting Staff and Self in Times of Crisis. I am Patricia Matthews, President and CEO of the Northern Virginia Health Foundation. For those of you who don't know, the Northern Virginia Health Foundation is the only health philanthropy in Northern Virginia that supports programs throughout the region. Today, we will focus specifically on the mental health and well-being of organizational leaders and staff who devote much time and effort to supporting their communities. Many of you with us today are helping others navigate COVID-19, economic uncertainty, and racial injustice. At the same time, you are experiencing these crises as well. Yet all too often, senior managers are far better at supporting others than they are in supporting themselves. I am joined today by two leaders from Northern Virginia Family Service, Stephanie Berkowitz, President and CEO, and Meredith McKeen, Director of Youth Initiatives and the Multicultural Center. For almost 100 years, Northern Virginia Family Service has provided expert support in crisis response and trauma-informed mental health care. They have supported communities in Northern Virginia impacted by tragedies such as 9/11 Pentagon attack, Hurricane Katrina, and the 2019 governmental shutdown. Stephanie and Meredith will discuss challenges many leaders face during times of crisis and provide tips, tools, and resources on how to effectively support your staff and yourself. As a note, we will take questions after their presentation, but you can submit your questions at any time by sending them through the chat box. Meredith, the floor is yours.
Thank you so much. And thank you everybody for taking the time to join us today. You can go to the next slide. We know that everybody right now has very, very busy schedules. You likely have a busy day ahead of you, and many of you may have already had a fairly busy day managing households and all of that in our new reality. So we wanted to start with a short exercise that will just help us focus on being here. So if everybody could go along with me, if it's possible, could you sit up straight and try to have your feet flat on the floor? If that is not possible or feasible, make sure you're sitting in some way that your body is fully supported and comfortable. And we're just gonna start by taking 3 deep, slow breaths. So breathing in and breathing out on your own pace, but making sure to breathe in all the way through your lungs and down into your lower belly. So take another one. And a third breath. Now take a moment and look around. Notice 3 things that you can see. Now listen carefully. Notice 3 things that you can hear. And finally, notice 3 things that your body is in contact with. Now take 3 more deep, slow, deliberate breaths. Again, making sure to bring air all the way into your lungs, down into your lower belly, and really feeling it. 1 more. All right. Thank you for doing that with me. The reason that we started with that this morning is that we wanted to have everybody experience a quick, short, fairly easy way to do a little bit of self-care, with the idea of demonstrating that it's really possible, after all, to incorporate self-care. Hopefully, some of you may have noticed feeling just a little bit different from when you started the day to where you are after going through that exercise. one of the goals of our program today is to talk about self-care, but also to make it clear that it is something that we can all do. I know that sometimes it feels like it might be a little bit overwhelming to think about adding one more thing to your to-do list or one more thing that just feels very daunting. And our goal for today is to show that self-care, not only is it essential for yourself and your staff, but it is also very, very possible. Self-care means a lot of different things to different people, and that's actually what's really important. So for some people, it could be something like the exercise that we just did, which again, pretty quick, fairly easy to incorporate, and nobody has to notice that you're doing it. But it could also be things like exercise, talking with friends and family, cooking, eating, or maybe not cooking. So again, self-care really encompasses a variety of things, and we want everyone to think about ways to do that for themselves and then ways to make space for their staff to do it. So we are not going to be here to prescribe any particular self-care routine for you, but just to remind us all how essential it is in the reality that we are currently navigating. Next slide, please. So part of our goal today also is to talk about this reality that as human service organizations, whether we planned it or not, whether we knew it or not, all of you, all of us, we are engaged in crisis response because of what our communities are experiencing. So if we are working with human service organizations, you are likely helping your clients navigate the crises they're experiencing. But even if you're not in a direct service organization, your staff are also experiencing these crises. So by helping and supporting staff, that is also crisis response. So our thought was to really take some of the information from the field of crisis response, disaster recovery, and trauma recovery, and just put it into a framework. Those concepts can be really, really helpful in thinking about the ways that all of us as human service organizations are organizing our work right now. As you can see from the slide, well, a crisis is any time of intense difficulty, trouble, or danger, which certainly is what we are experiencing now as individuals in a community. And as Pat said earlier, we have 3 large-scale, community-wide, worldwide crises that we are experiencing: COVID-19, racial injustice, and extreme economic uncertainty. These all certainly are things that are impacting us as individuals, but it is also a collective experience. So a collective crisis or a collective trauma is another way to look at that. So as I said before, we're all doing crisis response. And even if you as a leader or an organization have experience in crisis response, there are some aspects of this current situation that are so unique and unprecedented. And it is very unique, and that we are not only responding to the crisis, but we are all simultaneously experiencing all of them. The other piece that is unique about it is that these crises are not over. Often in the field of crisis response, we are responding after something has happened. We are all responding while it is also happening, unfolding, and evolving. So the ways that we are responding and caring for ourselves and each other also need to adapt, evolve, and respond. And I think the third piece, when I think about this, that is very unique about this one is that our normal access to self-care, or things that might normally be the ways that we take care of ourselves, are not always possible right now because of the pandemic. So if your self-care used to be going to the gym, and that's no longer possible, or if your self-care used to be spending time with friends and family, those things are not possible in the same way. So this crisis has also made it more than ever necessary to do self-care, but often more difficult to do that. So we really do all need to figure out new ways to incorporate self-care. Go ahead and go to the next slide. Actually, sorry, can you go back one? I gotta make one more point. The elements below about the losses that people experience, the reason this is really important when you think about a crisis, the loss of control, trust, safety, and a sense of fairness, this is what crisis does to people. This is what it does to all of us. But keeping these things in mind are also really helpful in terms of what it is that people need in order to regain a sense of control and equilibrium. So for yourself and your clients, what we're going to be talking about today is how do we put things in place that will address some of those losses. All right, next slide. So the important piece about the crises that we're all experiencing is that we are all experiencing them, but we are all experiencing this in a very different and distinct way. So each of us are affected in some way by what is happening, but it's really essential to remember that not everybody is impacted in the same way. For some people, for example, the quarantine and work from home might actually feel relaxing and helpful and more productive. And for others, it is incredibly stressful to also have to become a school teacher, to be managing the healthcare of individuals in your household. So everybody is experiencing this in a very, very different way. And just remembering each and every time how differently we could all be impacted. But some examples of the ways that people experience different crises, important to keep in mind. So there is the direct experience of the crisis. So for COVID-19, for example, you or someone on your team may have been positive for COVID. People on your team may have lost family members, or they could be caring for people who are sick, or like a lot of folks working very, very hard to keep vulnerable family members safe. So the ways that people are affected by COVID are very, very different. In terms of racial injustice, the ways that people are experiencing it, again, very different, but directly and currently, people could be experiencing microaggressions on a daily basis, or have been exposed to and are experiencing oppressions around structural racism that are different for every person. And in terms of the economic crisis, you may have folks on your team who, while they are working, their partner may have lost a job, or somebody in their household. So now folks who were not primary breadwinners are now in that situation. So just a few examples of the different ways that people are directly experiencing this crisis, but also clearly witnessing it indirectly through hearing about our friends and families' experiences. And that last bullet on there is what's really relevant to our work, is that there's also experience and exposure to a crisis based on the work that you do. So those of you in the healthcare fields clearly are responding to the needs of individuals who are directly impacted by all of these crises, but in particular COVID-19. So that's why paying attention to the ways that our staff and ourselves are experiencing this crisis. And in this particular situation, as I said, people are experiencing it in multiple ways as a provider, but also as a person. And I gave examples of some ways that people are experiencing or could experience each of these three crises, but it's really important to remember that a lot of our folks are experiencing all of them, or a combination. And that is the piece that's very, very different for each individual. Next slide. So one of the things that come from the world of crisis and disaster recovery is this idea of a phase, of a response and a recovery. So this visual is probably one that we find very, very helpful, just in helping us sort of manage our own expectations and set expectations for what it is like for individuals and communities to go through crisis response and recovery. The blue notes on the bottom are what are sort of stages of recovery. So there's a warning stage, which you sometimes have and you sometimes don't. There's the impact stage, which feels like the most difficult part, but is actually not necessarily. Sometimes things get a little bit harder before they get better. But in every one of these sort of large scale and smaller scale crises, these are phases that people go through. I do have a caveat on this. This graphic and a lot of the work in the world of crisis response comes from before this particular crisis. So sort of assumes a discrete time. So a discrete start and a discrete end. And so that is actually not the reality now. We are still involved in the aftermath, frankly, in the impact and the recovery sort of simultaneously. But if you look along the bottom, there is, after the impact, there is a moment where everybody sort of pulls together, and as a community and as individuals, we marshal our resources and we know that we can address this, we can help everybody recover. And there is often a period after that where people start to realize that despite all of our best efforts, there is still loss and there is still difficulty. And that is true in every case. And the important piece is that we know that, and we know that there's going to be that sort of dip, but that we are, as a group and a community and individuals, going to keep working towards recovery. So the part on the top of the graph, which is in red, also are ways to characterize individual reactions. So the bottom blue part is around the phases, and then on the top, ways that people, again, individually and collectively respond in crisis. So it's just really important to remember also that this is clearly not linear, but that not every individual or community is on the same path in terms of recovery. But we really want everyone to know, it's important that we all know this for ourselves, that there are going to be moments when this work feels really, really hard and feels really, really pointless. It is not. We're going to get through it, but it can be difficult. It takes work. But that's why we want to talk about sort of the highs and the lows of being engaged in this process so that people don't give up and that we keep working together. But I think the important part is this idea of sort of being on a cycle of response and recovery as an individual and as a community is very important because each person is going to be in a different place. And there can be challenges when someone's individual phase is a little bit different than the people around them. So that's the piece that's important when you're thinking about organizations also, is just knowing that not everybody is at the same place at the same time. All right, next slide. Oop, next one. Yep. Okay, so take a walk. The other piece around crisis reactions, this also comes from the world of trauma recovery. So this may look familiar to anyone who has had a Trauma 101 training. But one of the things that's really important for all of us to understand, again, for ourselves and for everybody that we're supporting, clearly, based on all of the characteristics of a crisis, which also include intense fear, potentially extreme uncertainty, and not knowing and not feeling safe, cause reactions, cause challenges, and these are normal things to experience. But the ideas of a sort of normal stress reaction versus an extreme stress reaction is really important concept. It's also important to know and remember that not every crisis is traumatic, but some are. Every crisis does cause stress, absolutely. Some crises cause extreme stress and potentially traumatic stress. Other crises cause what we would call normal stress. So we all know that stress is a part of life. And in a normally stressful situation, our brain and our bodies can work together to resolve it and respond thoughtfully, deliberately, carefully. So you may have a body reaction. If you're stressed out one day, you might have a headache, your heart might beat faster. You might feel a little bit anxious, but you also, because it is something that you're still in control of, can think through and figure out how to respond. In a crisis or a long-term collective sort of crisis or trauma, those abilities are completely shut down sometimes. So because of being overwhelmed, it feels like the helplessness is remaining. So people feel less capable of responding. But it's really important to also think about, again, for ourselves, excuse me, and everyone we know, the reactions that people experience are in these multiple categories. So they could be emotional. So you could feel angry or sad or hurt or anxious. A lot of physical reactions are very, very common. So headaches, stomach aches, fatigue. I'm naming only some. There are lots in each of these categories. There are lots of relational or social impacts. So people who are normally outgoing might start to really withdraw. There are also spiritual reactions and spiritual impacts, and people questioning their faith or feeling really distanced from something that used to be very supportive. Behavioral changes are also really common, just doing things very differently than you used to. And the cognitive impacts are sometimes really profound in terms of just not being able to think clearly, not being able to concentrate, and not being able to remember things or recall things. Self-concept is another one where during a time of crisis, and you'll hear me say this again in a bit, people start to doubt their own abilities and doubt their own competence because of the experience of feeling helpless and hopeless. So that is, again, all of the reactions that I described are perfectly normal and they make sense. This is how we cope with a very extreme situation. Some of you may have heard this phrase, but it's a really good one to remember. These are normal reactions to an abnormal event. So in and of themselves, it's not a problem. It doesn't mean that there's anything seriously wrong if you're experiencing any of these reactions. However, if they're unaddressed, if we don't do self-care to try to sort of mitigate them, they can become problematic. So if these impacts remain, that is when there's a longer and larger challenge. But proper self-care, helpful self-care really mitigates these impacts. And I think it's just a really good sort of list and way to remember that people all also react very differently. So you may not see the way that everybody is reacting. Some of your folks may be showing up to work seeming to be coping absolutely fine, but they may not be. I think it's fair to say at any given moment, given everything that's going on, very few of us, or some of us, we're not all functioning at 100% of our best selves all the time right now. And that's just frankly not always possible to do. So sort of being kind to ourselves and being kind to each other. But just because these reactions are normal and make sense, it doesn't mean that we don't need to address them and pay attention to them. I think the other piece that's important here that we want to highlight, just as there are different domains where people have reactions, then self-care needs to be in all of these different domains also. So a physical activity or some sort of physical activity is self-care because it addresses the physical symptoms, but there are emotional self-care pieces, relational self-care pieces. So thinking about self-care in all of these domains is really, really helpful. Next slide. So we just talked a little bit about reactions that people might experience that make absolute sense. And here's where we really want to talk about why it is and how it is that people are experiencing these crises differently, and therefore why it is that their reactions might appear differently in every crisis, every single crisis. There are equity dimensions and there are disparities in the ways that the crisis impacts people. This is especially true for the 3 crises that we are experiencing right now. So there has been an increase in racism and stigmatization because of the way that COVID has been talked about, because of the way that people perceive who is impacted by it, who has been more sickened by it. In terms of the health disparities, again, I'm speaking to a number of healthcare professionals, so you know this, but we know for a fact that people of color are facing far graver outcomes in many cases than white people. So the impacts on the people on your team are potentially greater. If you have a staff who are of color, they may have lost family members at a rate greater than your staff who are white. So there is just a real clear difference in how these are impacting people. The other piece is that we know that existing disparities have exacerbated the crisis. So people who are working at service jobs, subsistence jobs, without insurance, have to continue to work, but are exposing themselves more, for example, and have far greater economic impact. So these are a few examples of the different ways that equity, existing equity and disparity is exacerbating the crisis. And I think the other piece that is really, really key to this current crisis, COVID in particular, is around the definition of essential workers and who is an essential worker, and the impacts that that has on themselves and their families in many, many ways. We saw early on in the crisis, because what was being put out and what was needed for people to keep themselves safe was to be able to get 2 weeks of food, to have medicine on hand, to be able to have all your cleaning supplies to keep your family safe. And if you are low income and you do not have money for basic essentials, you can't do the things that are needed even to keep yourself safe. That increased people's level of fear and terror and increased the impact of the crises. The school closures impact is going to have a disparate impact on people depending on their socioeconomic situation, whether or not they have access to Wi-Fi, but also if people can work from home or can't work from home, depending on the nature of their job, means that they either are or are not able to be there with their children to help them stay in school. So the education gaps are widening. So it's important to remember not only are the current impacts very, very disparate, but the longer term impacts are going to be disparate also. All right, next slide. So another piece about crisis recovery. So this is back to sort of what I referred to into the beginning, what the impacts of a crisis are. This piece that you're seeing here, these 5 essential components, it comes from psychological first aid. These 5 things are the things that people need to start to recover from a crisis, to feel a sense of safety, to have calm, self and collective efficacy, to feel capable and competent, creating connection and creating hope. So those 5 things are the things that leaders can do. And so thinking of ways that organizationally and individually, these are things that can be done for the people that you work with. This is what is really helpful now, what is essential now. Another way of looking at it is this idea of just restoring competence. As I said before, people feel really not capable sometimes or not competent, because the other piece that's really important in a crisis is that while a lot of our regular work has continued, there is also a whole new set of either services that are needed, a whole new way of doing things that are needed. So what success looks like right now because of the crisis might be different, but you might have employees, staff, colleagues feeling like they're not doing a good job because they can't do their job in the same way, or they may not have the same outcome. And so I think it's important to think about organizationally, what are the ways that we can create these 5 things so that people feel safe, calm, and also feel capable and effective. All right, so Stephanie, I'm going to hand it over to you to talk about how organizations do that.
Thanks. Thanks, Meredith. Appreciate it. So we're in the human serving business, right? And when we were hit with the pandemic in March, it was quickly apparent that that human to human interaction was creating the greatest health risk. And if we think back to why are we in the business that we're in, fundamentally, I would imagine that many of us got into this work to serve or to influence the greater good. So we're oriented towards serving others. And so whether we're providing healthcare, we're distributing food or operating shelters or doing outreach or case management or therapy, whatever it is that we're doing, we are in the business of helping others. And so if there's one message that you take away this morning, we hope it's that a recognition that as leaders, we can't sustain this work in service to humanity or to the greater good if we don't take care of ourselves. So in a career where our fundamental purpose is to influence the greater good, it's natural that we're going to keep going, right? As human service organizations, we didn't close down when COVID-19 struck. In fact, we did the opposite. We asked our staff to redesign our operations. Overnight, we had to figure out how to continue to deliver our services, how to engage our stakeholders, how to meet our contract objectives. We wondered if we were going to get paid if we didn't deliver on our contracts, and what fundraising is going to look like now, and how do we interact with our board in a crisis, and how do we communicate effectively in a virtual environment. And as leaders, every day we wake up thinking about how are we going to keep our staff safe, right? How are we going to equip everyone with the tools they need to work remotely? Where are we going to find PPE? The questions, they just keep flying at us. And as leaders, everywhere we turn, our staff is looking to us for those answers. And we're all worried about our loved ones' health. We're exhausted from juggling work and home responsibilities. We're trying to support our kids' virtual learning. We're trying to figure out how to get medications and food to our family members who are vulnerable. As leaders, we're not immune to any of this. We see it every day in our staff, but we have to remember that we are also among those who are daily impacted. And these stressors come into our workday every day. And in today's environment, it's virtually impossible to compartmentalize. We don't physically leave, and many of us, many people are physically going places and delivering on our work. But in general, it's harder these days to compartmentalize. So our employees are looking for that calm, that connection, that hope, and that sense of safety that Meredith talked about. So this is all real. This only scratches the surface. We're still trying to write our strategic plans and develop programs and nurture partnerships and engage our stakeholders. And we've got board retreats to plan, and it's a lot. And we're doing all this on top of our everyday job. And look at us. We're here. We're doing the work we need to do. We're getting through each day. We're relying on our instincts. We're leading on our teams. We're talking with our colleagues. And yet, really look at us. There's so much going on below the surface, and as leaders, it is oftentimes we just power through, and we don't acknowledge that this is all impacting us. And there's just too much to do, right? But as Pat said at the outset, we're excellent at telling our staff to take care of themselves, but we either feel like we don't have the time, or we're focused on helping everyone else, and we just simply forget to focus on ourselves. And suddenly the day is over and we need to figure out dinner, the dishes are piling up, the laundry's multiplied, and we tell ourselves we'll find some balance tomorrow. And then tomorrow comes and we repeat today. So how do we break this cycle? Well, as senior leaders in our organizations, each of us is uniquely positioned to influence our organization's priorities, our culture, to lead by example, and that's critical. This has to permeate throughout the entire organization. And our goal today is to really think about, how are each of us leading? What example are we setting? How are we being intentional in our efforts? Because it's that intentionality that will help make sure that we're focusing on the things that we really believe are important. And those priorities shifted when the pandemic struck, when the crises that Meredith talked about and the impacts of those crises continued to mount. We can't just focus on what's in front of us. We have to be intentional about how we spend our time and our mental energy and our physical energy. So here are 3 questions to consider that'll help us stay intentional. The first is around our values. What are the values that are core for you as a leader in your organization? What are your organizational values? Are the conversations that you're having and the decisions that you're making, are they aligned with your values? Because centering on your values can help us guide our priorities. The second question is around leadership and organizational response. So one day, when we all reflect back on this time, what is the story of your leadership that you'll be proud to tell? Right? So every day when we wake up, we have choices to make about the kind of leader we'll be, the messages that we'll send to our team, the factors that we'll consider when we're making decisions. And if we encourage our employees to take care of ourselves, do our organization's policies support that? Are our supervisors and managers empowered to make decisions that will support their team members' well-being? If an employee runs out of sick leave, for example, and their parent gets COVID, what will we do if she needs to quarantine or take time off to care for her sick parent? So the third and arguably the most important question is, how are you consciously taking time for your own health and well-being? Your organization needs you to be kind to yourself. Your staff needs you to model self-care. They're watching, they're following your actions, not your words. And resiliency is a word that we have to dissect, but in its broadest sense, resiliency may be instinctual at first, but over time you have to consciously build that muscle. We can only run on adrenaline for so long, right? So these next few slides around leading by example start to share a few examples of what to think about when we lead with intention and we use our power and our authority as senior leaders in our organizations to create the structure and the culture and the operating norms that support both ourselves and our teams during this time. So when we think about leading by example and that broader organizational response, let's start with some macro level considerations, right? For me, our people always come first. They're the most important asset that we have. For me, this is core to our values. And it means a lot of what Meredith was talking about earlier. It's around applying an equity lens. It's considering the individual needs that our employees have because of their individual circumstances and the way they're experiencing these crises. For us, it's about prioritizing employee well-being. We've embedded that as part of our culture, as part of our benefits package, as part of the way we interact with our staff every day. When we talk about culture, it's about encouraging open dialogue and really creating systems where we're listening and we're learning and we're not assuming, right? Assumptions, we know from everyday living, assumptions are our biggest enemy. So how do we listen and how do we learn? How do we really truly create a culture where we're modeling adaptability and flexibility and learning and vulnerability? How do we, as I said, embed well-being into our cultural norms? For us, we relooked at our employee recognition programs and what should they look like during this time. We're looking at our flexible work schedules, and while that might sound like an HR issue, it's really fundamentally a cultural issue, right? Especially now with so many of us working both virtually. One of the wonderful moments, we were on a town hall with our team earlier, maybe in probably April, early in the pandemic. And it was a town hall with our leadership team that were all on camera, and we had hundreds of our staff listening in webinar style. And some of our leaders, told our staff just organically, it just came so naturally. They said, taking a walk in the middle of the day, taking 15-minute breaks throughout the day, that is part of your job, right? That is not an additive piece. That is not, I hope you'll do this, or it's good for you to do this and we encourage you to do this. It literally, we are telling you right now, our senior leaders are telling our entire team that this is actually part of your job. In order for you to be effective, you've got to take those breaks. So whatever that break looks like for you. From a cultural perspective, another example is talking with a board member, and she said in her organization, they made a decision that they're not going to let women in their organization leave the workforce because they can't figure out how to balance work and the home life challenges. So before they let anybody walk out the door, they're going to look at every single possibility, part-time, flex time, job share, whatever the case may be, to make sure that another woman in our society doesn't lose a job because of the stressors that are happening around her. That's a cultural decision. I know that's a decision about how do we want to be as an employer, as a leader today. When we think about our operating norms, this is not a normal time, and Meredith spoke quite a bit about that. So, if we think about that, what is our operating norm today need to look like, and how is that different from what it looked like, months ago? To that end, one of the things that we did early on was established a task force within our organization with folks from across the entire organization about what things look like moving forward. It's not a return to work. It's not a crisis response. It's about moving forward. How do we support our employees today and make the decisions that we need to make today to help support everybody tomorrow? What conversations are we having with our boards and our executive and our senior management teams? How are we thinking about expectations and priorities, and how do they necessarily look different today? We can't just pick up and keep doing what we were doing before these crises hit. We have to evolve and continuously evaluate, which we're all already doing every day. Everyone on this call has been doing this instinctually. What we have to remind ourselves is that this is a necessity. This is the space that we are in right now, and it is okay if our accomplishments, if our goals, if the things that we're doing today look different than they did a year ago. Of course they do. We're operating in a completely different environment. We've been looking consistently within our own organization at our leadership and our management structures to make sure that we're supporting real-time decision-making at all levels of the organization, so that it's a lot harder to just walk by someone's office and ask a quick question. It's a whole different virtual environment that we're working in. So how do we make sure that we're empowering staff at all levels of the organization to be able to quickly and decisively make the decisions and find the supports that they need to have to do their jobs. For some time, we've been building our communication muscle as well. And we've been creating committees that bring staff together from across the organization around looking at our well-being work, looking at focusing on our equity, diversity, and inclusion work, looking at our training work. And this muscle that we've been building for some time allowed us to quickly put together, quickly pivot and create the Move Forward task force that I mentioned earlier. Communication is a given. We all already know that in times of crisis, frequent and clear communication, over communication is absolutely critical. Some of the ways that we adapted at NVFS, and we continuously adapting and keep listening to what's working and what's not working. Our town halls, we have a regular opportunity. It's been about once a month where we're bringing the entire organization together in a webinar style town hall to make sure that we're providing the most important updates in person, meaning speaking and not just in an email. Early on and in the months since, we established what we used to have snack and shares in our organization, where myself and other senior leaders would go around and make sure that we're visiting all the sites. We have touch points with all of our staff all over the region. And since we can't obviously be in person, we converted those to Zoom and shares, where we're setting up Zoom video conversations with small groups of our team members from all over the organization. And the first round of those were 100% focused on well-being. How are you? What are you doing to take care of yourself? It was critical, and my intention in that was to send the message that what matters more than anything right now is you as our employees. And it was a way to really open up those lines of communication early in this crisis. And then from there, we've evolved the purpose of those Zoom and shares, but keeping those lines of communication open has been really, really critical, especially when we're just not physically seeing people the way we used to. Our leadership team, our broader leadership team in the organization began meeting more frequently, again, to keep the dialogue open, to lift the issues up that senior staff, that senior team needs to be talking about, including how are we all taking care of ourselves so we can best take care of our employees. We'll look a little bit later at how we can support some of our staff around individual supervision and team meetings and training and all of these things that are so critically important, that it's so important to be intentional about. When we think about policies and guidance at the macro level, as I mentioned earlier, it's so important that our policies align with our values. When the CARES Act was passed, and when in these past months, we've had to consider how some of the new laws and the new guidance impact our employees. How are we going to interpret the Families First Coronavirus Relief Act, FFCRA, and look at how we apply sick leave and childcare leave within our existing leave policies? What will we do with we had the option to defer tax for our employees. How would we want to handle that? When the Paycheck Protection Program came around, we had to look at what that looked like for our employees and our workforce. Within our own organization, we made a decision early on to implement pandemic premium pay for mission critical public facing positions. So, because we have a handful of folks across the organization that continue to work directly face to face with the public in our shelter and in our hunger resource center, and so we looked at a way to make sure that we were recognizing the additional risk that created for our individuals' health, our employees' health. And again, in the context of policies and implementation and really being employee centric, we've charged our Move Forward task force with really thinking through and thinking ahead around the use of PPE and social distancing, and how we're using our office, and how we make sure that we're applying the equity lens across the entire organization when we put policy level and procedural level policies in place. Stakeholder engagement, everyone is doing the best job we can given the circumstances that we're in. And these conversations with funders and our partners and our supporters, our volunteers and our staff, they're so important. It's not business as usual. So we just need to figure this out together. So if we just default to picking up the phone and having a conversation, or recognizing that we need to engage each other in solutions and challenges, and if we're adaptable and we're flexible and we're patient, then we can get through each day. Are we talking to our clients about what's working and what's not working? How can we be more creative in our service delivery? You know, as a leader in our organization, if we're creating the space for these conversations and this creativity, then we're creating the safety and the connections and the hope and the possibilities that again Meredith talked about earlier, that are so important to our staff. We can click to the next slide. You know, when we think about modeling here, down at the bottom there, I think about, you know, I know we're all Zoom fatigued, but the reality is we're all using Zoom or Microsoft Teams, whatever video platform we're using, we're fatigued by it. When we think about modeling, you know, how are supervisors reacting when they're in a supervision session with their team and the cat curls up in front of the camera? Are they laughing it off, or are they frustrated? You know, how we present ourselves during this time is so important. You know, of course, the cat's going to curl up in front of the camera. The kids are going to walk by. The doorbell is going to ring. The construction is going to happen outside at the most inopportune time. But we have a choice in terms of how we respond to that, and how other employees see our response, and understand how safe of an environment is to just be able to be ourselves and be who we need to be during this time. When we ask others to take care of themselves, it's important that we share what we're doing too, right? In those early days of those Zoom and shares, it occurred to me that every day I would start every conversation with, what did you do this weekend to take care of yourself? Did you get outside? Did you enjoy the beautiful weather? And for a while there, I kept stopping myself and thinking, oh dear, what did I do? Right? Like I need to kick it into gear, because I need to take care of myself too, because I need to hold myself accountable to be able to answer that same question when I ask my staff. I need to be able to model that I really do believe this is important. So when we look at, so these are just some strategies and some examples, and Meredith and I would be happy to answer some questions more related around to some of these, if there's some interest around supervision and training and team meetings and self-care, and implementing debriefs into the work, how we engage partners. You know, these are just some strategies and examples of how we can influence, we as leaders in the organization have the authority, the responsibility, the privilege of being able to influence the culture that we all are working in. So we can look at the next slide. And again, as you may have sensed by now, that for me, human capital is the most critical, because that is what drives our ability to deliver on our mission, to deliver our services. It's so critical that we give our employees the space to have their own self-awareness and to bring their own needs forward. When I say their own self-awareness, I mean, and the safe space to be able to tell their supervisor what it is that they need. And I say often that as the environment in which we're operating evolves, so too might your needs. So please keep that dialogue open with your supervisor, with your manager. Some of the specific tactics that you see here on the slide is, you know, what can we do to help our employees manage their workload, to manage their schedule? How flexible can we possibly be? Really, not do we think we can be, but how can we really be flexible? One of our team members in our HR department has I forget, I meant to look it up before the call, but has a line in the bottom of her email that says so beautifully, you know, I work hours outside of normal business hours due to my family obligations. If you get an email from me late at night, please don't feel like you need to respond, or something like that, in a very concise and succinct way. And I think that's great. I mean, our expectations and have to be different, but it's really nice to just say that out loud, right? I can't imagine an employee would feel like they need to respond at midnight, but maybe somebody would. So to really just explicitly put that out there and say, respond when you're able, it's okay. It's just it's a generous and kind way to approach that employee engagement. So, with this, again, I would just encourage us to keep that second question in mind that I asked about when you reflect back on this time, what is the story of your leadership that you'll be proud to tell? Because we can't take everything on. We have to focus in on those values and what's really important to us, and really continue to center ourselves in that regard. The last slide is just one more reinforcement here about your own well-being and self-care. We can click to the next slide here. This is really about just treating yourself with the same grace and self-forgiveness that you naturally treat others with. We're in the roles that we're in because we have exceptionally high expectations of ourselves, but we are in a pandemic, and self-care fundamentally is about replenishing your energy in whatever way that works for you. And so that very most important question that I asked earlier, how are you consciously taking time for your own health and well-being? That is what's fundamental. Your organization needs you to be kind to yourself. We're all human, and we deserve that same level of dignity and respect and self-nourishment that you give to everyone else every day. So with that, I think for the remainder of the time, we're going to kick it over to Pat, and Meredith and I would be happy to talk or reflect on any thoughts that have come up.
Thank you, Stephanie. We do have some questions. One, could you talk more about the Move Forward Task Force? What's its composition? What's its function? How has it worked for you?
Yeah, absolutely. So back in February, we kicked off, as soon as we had wind of a pandemic, we kicked off a COVID-19 response, start to just think about what do we need to do? How do we create safety mechanisms in how often do we need to clean? Do we have Clorox wipes? All those things that sort of in that moment, in that now. And after we moved out of the crisis response into that next phase, we evolved that group into a move forward. So again, it was no longer about responding to yesterday or today. It's about what are things going to look like moving forward. So that is a group that I sit on that group, and I joined that group. It's really important to me to understand what's on people's minds. I have one or two other members from our executive team, a number of folks from our leadership team, and then a number of folks just from all across the organization. We have every part of the organization represented in that group. The group is, I think, maybe about 20 folks, no more than 20. From all of our administrative places, IT and HR, and to all different areas programmatically across the organization. So it's really about, and I'd be happy to follow up with more specificity, but it's really about looking at how do we make decisions about when we resume in-person work versus when we stay virtual, because in the work that we're doing, it's all critical, right? It all feels like it has to happen in person now. And our staff are, as everyone's on this call, are so passionate about the work that the hardest part is actually sometimes getting people to scale back and say, look, do you really have to do that in person, or can we just do a no contact? So again, I know there's a lot of questions, but.
What would you say to an hourly employee who may feel bad for taking midday walks or 15-minute breaks on the clock?
Yeah, well, so that's exactly the question that came up in our town hall, is that an hourly employee was expressing concern about charging their time when they're hourly, and was essentially telling us that they were not going to charge their time for that, when her senior manager turned right there very publicly and said, it is part of your job. We need you to take the time to replenish in order to do your job. Meredith, if you have anything to add.
Yeah, I mean, I think it's that what we're also trying to do, there's the concerns that employees bring up, But we also are always trying to send messages because we know that folks are not always going to say what's on their mind. So I think what we worked really hard to do was name how different. And in the case of NVFS, we are doing some remote work and we are generally direct service providers. So it was a very big shift. And we realized the workday when you are working from home, if that's what you're doing, has no breaks built in the way that it would if you were in your normal office setting. You wouldn't think, I'm going to take a break now, but you would get up, you would walk, you'd go to the copy machine or get a coffee, or, you know, there's things that happen naturally when you're doing your role normally that we realized just stopped. So it was just redefining for everybody. Now that you're in this new work reality, actually getting up from the chair that you've been sitting in, you know, the workday just feels more dense for people right now. So we even had to go through it and say, wait, this feels really different. So let's make it clear that it isn't an extra or a luxury to get up and stretch, and that we actually need our employees to do that because otherwise they will not be productive. So it was redefining what work is right now. Work looks very different. But we had to be really, really mindful and proactive in saying that that piece is included. It used to happen naturally, and now we have to make it happen.
Stephanie, in reviewing new policies, how did your HR department incorporate the views of frontline workers?
Yeah, that's exactly when I talked earlier about that we've been building this muscle for years. It's really important anytime we put a new policy out or a new procedure that we gather the input from staff from across the organization. So in some cases, we've got task force design for certain initiatives or certain priorities of the organization. We're always, you know, again, building that muscle of open dialogue. Our HR department is always asking for feedback, and when we put something out there, they're asking to provide the input, provide the feedback. We looked really carefully, again, from an equity lens, with the highest level of intention at every position in the organization and how certain decisions would impact. So, you know, from the frontline workers are operate across our entire organization. So really looked intentionally at how decisions would impact folks across the organization. And with some of the new policies that came out, like FFCRA, we figured out how they fall within our current policies. What comes first, what comes second, what comes third. We also took some of our existing policies and we expanded them and made them more flexible, because we knew that the definition of needing to take a day off looks a whole lot different. And we added a couple of, we added a mental health day. We didn't call it that. We added some additional leave days. That was the intent. That's not what we called it. We added an advocacy day in response. We gave election day off as a permanent holiday. Juneteenth is now a day off. That's in response to listening to our frontline employees, to all of our employees, about what's important, what's driving, what is meaningful for them.
Thank you. Just checking the chat box. So we're coming to the close of our session. I'd like to thank both Stephanie and Meredith for doing this work. And I'd like to thank all of you for joining us today. This has been recorded. We will send you the recording and the slides via email. If you have any questions we didn't get to, please feel free to reach out to us. Also, you will see a link to a survey when you close out of this screen. We would love to hear any feedback for you for future webinars that we may do. Thank you all so much and have a great day.